You know, a key question I'd like to ask is, obviously you voted in favor of the Affordable Care Act, and there have been some issues with it and some heavy criticism of it. If that thing came back up today, would you still vote the same way?
It's not perfect. There's no doubt it's not perfect. I think everybody agrees that our healthcare system was broken. When I tell my Republican friends, I've told them all this, and they don't have a great answer. What I tell them is, I say, look, if you have something better, I'll vote for it. Give me something better. I'll vote for it. I'll vote for it today. You put it in bill form, let me look at it, let me read it. I'll vote for it today. Give it to me. They never come up with anything. I think the best thing we can do at this point is take the law we have on the books and work on it and fix it. And there are problems with it. Whenever you have a big comprehensive piece of legislation like that, and I've been around for a few of those, since I've been up there. If you get 80% of it right, you've probably done something. And the truth is, we probably did get 80% of it right. You never hear about the stuff that's working, I mean, things like pre-existing conditions, things like setting up the marketplace, the exchanges, so that, not y'all in this room, you'll probably get insurance through the paper, but for so many Americans that are individuals and small business owners and whatnot, that they need somewhere where they get insurance, and the exchanges are working. And to add 102,000, I think the paper said this morning, 102,000 people to Medicaid in Arkansas. That's going to help every rural hospital in the state. I mean, so there's a lot of things that are working and are working pretty well. I don't want to throw those out. One of the things we did in this law is we did a pretty good job, not perfect, pretty good job of leveling the playing field with the insurance company. Before this law passed, you could literally, truly be with an insurance company for 20 years. You could pay your premium every single month and never use it, really to speak of. And then the day you get diagnosed with cancer, they could cancel you. They can't do that anymore. I mean, that's a major reform. The number one cause of personal bankruptcy before this law passed was medical bills. People in this country, before this law passed, they were one bad diagnosis or one accident away from bankruptcy, financial ruin. Well, I'm not saying that'll never happen again because circumstances, but at least now what you've done is you've made insurance more available. And, with women, they used to discriminate on the prices. They used to charge women more. They don't do that anymore. There's a lot of reforms in there. I think that when people look at it, they think this is good, but you just never hear the good news stories. What you hear is the bad stuff. And there are things. I mean, look, I could go through a list. I'm working in Washington right now. I don't know how many we have, 10 or 12 or 15 different things that we're looking at about we need to fix this. How do we fix it? But one problem with, if you really want to fix healthcare, you can't put it on a bumper sticker. It is complicated, man. You get down in the weeds. I mean, you got to really get down in there. You have to talk to a bunch of people and sort it out and look at the numbers and get really, really serious about it and focus on it. And then you can do the fix. You may never get any credit for it because it's so technical and so dependent on all these other things, and people don't take time to connect the dots and all that stuff. But we can make the law better, and we should. I feel like we owe that to the people who are trying to make it better. But again, if you vote to repeal it, and again, my opponent has a number of times, if you vote to repeal it, all the good goes out with it. In fact, I don't want to touch on this too much, but we talked just a minute ago about Medicaid, the Medicaid expansion in Arkansas. My opponent has already voted a number of times to kick those 100,000 people off Medicaid in Arkansas because he's voted to repeal this law. And the private option is based on this law. If the law goes away, the private option. So he's already voted to cut all those people off. Not to be too dramatic about it, but there's a way to fix this law, and I don't think you do it in one bill either. I think you've got to get in there and work on a section and work on this, but you can do it over the course of a year or two, you know. But you have to have a serious conversation, and you have to have adults in the room that are willing to spend the time to get down to the weeds on it and fix it. So that's where I am.
Well, on balance, that sounds like a yes.
Yes, I think on balance that would be a yes. I mean, of course, if I knew some of the problems that were in it today, I would have tried to fix those when we were drafting. But try to fix it when we were drafting it. But on a lot of this, again, healthcare is incredibly complicated. You don't know how the market's going to react. You don't really know what hospitals and doctors. You just don't know how it's all going to. You don't know how the insurance industry is going to do. You just don't know. You kind of make your best educated guess and think you got it right. But on these kind of bills, what happens is some of it is going to work better than you thought. Some of it's going to work worse than you thought. You know what I'm saying? And you just don't really know until you get it in place and let it run for a while. And to me, if we're going to try to make every bill we pass perfect, we're never going to pass a bill. Because every piece of legislation you can imagine, you go in and you change it. The U.S. Constitution, we got amendments to it. I mean, it wasn't perfect when they did it. It's the best document ever written by man, but it wasn't perfect. So you go in and you change it and you make adjustments. And that's, to me, that's the way all legislation is. You put it on the books, hope it was a great piece of work, but over time it's going to need some work. So that's where I am on it.